The Front Page on Radio Free 102.3 KJLH.
It's a special edition of The Front Page, dealing with the coronavirus. An incredible panel. We have with us in studio Dr. Kuvengwa from Martin Luther King Hospital, Dr. Reed, family practitioner, Dr. Gloria Morrow, who is a psychologist, Congresswoman Karen Bass, just a few more minutes with us on the phone. I know you're busy trying to keep our country afloat at the moment. Congresswoman Bass, I have to ask you this because so many people have been asking me this. They're concerned that they are going to be locked down, like that we're going to have, because we have the state of emergency declared by the president last week, that somehow people are going to be locked down in their houses, in their communities, martial law, all the rumors that are going around. Congresswoman Bass? Okay, we are going to get Congresswoman Bass on the phone because I really, really want to get that question answered. I know that's not going to happen, not on a widespread level, but I'd like to get it from someone with more knowledge than I have. Let's try it again. We ready, Emmett? Okay. Congresswoman Bass, are you there? Oh, okay. We don't have her. We'll get her back on the line. I know people are worrying about a lot of things. Let me ask our panel right here while we get Congresswoman Bass on the phone. What's the rumor you'd most like to dispel that you're hearing in your work? Who wants to start? Dr. Morrow, you want to start?
Well, in my practice, most of the folks who are the most distressed are people who already have anxiety. So their thing is that, am I going to die? Should I get other procedures? And some people have a conspiracy theory thinking that somebody's doing something to us. So I don't want to have my procedure because something could happen to me. So I think that's one of the biggest myths that, people are just on the doorstep of death with this virus.
Yeah. I would say for me is I think one myth that came up earlier today in our conversation is that Black people can't get COVID-19. I know no virus that discriminates based upon melanin. And, it's just kind of odd to me that we would even come up with this theory. And I think it does have something to do with the fact that the African nations have not shown that there have been many cases there. But I think that we have to, perhaps take into account what the infrastructure is there as well. And, what is the testing that's being done there to accurately account for who has been affected. And, we're dealing with a virus that looks like many things. Looks like flu, looks like cold. So, you could be walking around with it and be unaware. So I think that is something that should be dispelled, is that, it does discriminate based upon certain characteristics, and that even it being called a foreign virus, there's no such thing. A virus looks for a viable host, period.
Yes.
Yeah, great point. Dr. Kuvengwa?
I guess I'd like to make a quick point about testing. So at the moment, because testing resources are so limited, it is at the discretion of the medical professional who's caring for you if you meet criteria to be tested. It's not that we don't want to test people. If we had enough kits, we would be testing everybody. But we're just not there yet. The research is ongoing. We want to test people. And a quick note is that the commercial labs like Quest and LabCorp, you cannot just present there and say you want to be tested. It has to be ordered by a doctor and collected in their office. And I think one of the main things is if you are feeling ill, calling ahead of time is huge.
Yes.
Because we're trying to make doctors' offices and hospitals safe for people to come and visit to get the help that they need so that they're not afraid of being infected. If someone has a mild illness and they're able to stay home and care for themselves, we encourage it. If you need us, come and see us because we want to help.
Yeah. Okay, so let's go back to the phones. Congresswoman Karen Bass working right now. She can't get back with us. What I do know from my research is that they've already cordoned off one county in New York. Not a county, one part of the county, because there's a high infection rate. So where they actually, do the yellow tape or whatever, and you can't go in or out. Kind of like what they've done in all of Italy and what they did in China. And what happened was they were able to get the virus levels down by isolating it. So we have seen that. What I don't see any indication of is widespread martial law, which is the internet rumor, where people would be locked down, where they wouldn't be able to leave their home. You can still travel. There's travel restrictions, but you can still travel. If you're an American citizen, you can travel. It's not recommended if you have a respiratory problem or a chronic illness, but you can still travel. You can still come back from Europe if you're an American citizen and you're healthy. And if you're coming back from certain places, you're going to have to be self-quarantined for 2 weeks. Right, Dr. But you can still go. I mean, I think we're taking everything too far. We could see areas cordoned off. But even in those cases, even in China, where they have a totalitarian government, you could leave for an emergency. You just couldn't go to the movies or whatever. If you had to go to the hospital or whatever, you were still able to leave. We are, by the way, streaming live on Facebook right now, Radio Free KJLH, if you want to see what you're hearing. And we will have this available. If you missed this special, we'll have it at kjlhradio.com on podcast, so you'll be able to hear everything. Let's go to, we have an anonymous caller from Los Angeles. Good morning, Anonymous.
Good morning.
Good morning.
Good morning. Welcome.
Thank you for having me. I have a couple of questions, and my first question is, if they're closing down the schools and not allowing the students to go to school because of this virus, what difference is it going to make putting them all together at some facility?
Okay, I can answer that, but I want to get all of your questions at once.
Okay. Then the second question is for the doctor. I'm sorry, I didn't get her name. They work at King Drew. I have two questions.
Okay, Dr. Kavengwa, but just tell me the questions. I'll make sure we get them all answered.
Okay. And the first question is it true that a couple of employees tested positive for that virus? And if so, what measures are they taking to put the other employees who work at that?
Got it. And your third question?
That was 3 questions.
Oh, I only got 2 about schools. And great. Oh, the other one was the follow-up. Got it. Okay, so I guess we start with you, Dr. Kavengwa. The rumor mill is upon us.
So, no, we haven't had any employees test positive. We're testing patients according to CDC criteria and LA County Public Health criteria, but we have not had any employees test positive, no.
We know that there are hospitals across the country where, especially in foreign countries, where healthcare workers are getting sick. And please believe they're taking, all precautions to make sure that doesn't go around to patients and that those healthcare workers are well. I feel like I have to say this over and over again. 98% of people or more who get this virus will not die. They will have a flu-like sickness for 2 weeks or 3 weeks or however long it goes on, could go on for however long it goes on, and then they'll be better, right? Mm-hmm. Right, Doc?
The most severely affected people looks like people who have chronic medical conditions, advanced age. Bad things can happen to healthy people, but we're not dealing with something where young, healthy people are the vast majority severely affected.
Okay, so then as far as the school closures, so it's this concept of social distancing where we keep people away from each other so they won't infect each other and continue to spread. The issue is not, we're paranoid that we're all going to die. It's because we want to contain the spread. So what Councilmember Herb Wesson told us earlier on the program was that they are going to be checking children as they come into those service centers. Any child that has a fever or any signs of sickness will not be allowed in. They will be sent home. That's one thing. The only people that are going to go to those service centers are people that need services. Either they need childcare or some kind of meals, hot meals that will be served there. It will be 6 a.m. to 6 p.m. So far, there's 40 of them. They'll be listed on the LAUSD website starting Wednesday. That's available. Why? Because some people have to go to work and they don't have anyone to watch their child. Some people don't have the means to feed their children and they're relying on those hot lunches. Yes. So it provides an alternative. By shutting down the schools, people have the option to keep their child home and self-quarantine. Mm-hmm. And also by screening the kids going into the centers, it makes it much less likely they would infect each other. The other thing is we had one 9-year-old who was infected, was reported today, but that child was a child with a chronic illness. illness. So in general, what we're seeing is children aren't really, for the most part, high risk in this.
Yeah.
So I just wanted to, but what they can do is carry the germs around
They
and
can't
bring them
pass
to
it
you,
on.
right? So
Yeah.
maybe we're protecting ourselves. I hope that answers the question. Anyone want to comment on that?
Yeah, I think that the point of social distancing and trying to minimize as much as possible human contact, that is necessary when you're trying to control a virus, and particularly that causes mild illness. Because I think that sometimes it can be more challenging to control a virus that causes mild illness versus one that causes more significant, severe outcomes. Reason being is that when you have a mild illness, well, you may be asymptomatic and or you're in the community. So you're in your homes, you're in your schools, you're in your jobs, you're passing it on and allowing a virus to do what a virus does, which is look for its next viable host. But when you have compare that to like a SARS or a MERS, right? Also coronaviruses that cause more severe illness. So typically those individuals, you can pinpoint them right away, right? They're ill enough to perhaps to get to the hospital, they're hospitalized. They're more likely to succumb to the virus because the death rates of SARS and MERS was 10% and 34% respectively. So much higher rate. So in that case, essentially the viral cycle ends at a certain point. The host is no longer to carry it on to others.
Right.
So it can almost create a situation where it's easier to control a virus that's more devastating versus one that causes mild illness because people are out and about. So a blessing and a curse, if you will. You're less likely to die, but more likely to get infected. So it's important for us to understand that, and that, you know, having to navigate a little differently now to prevent that potential for exposure.
Okay, we got to go. We're passing the mic back to Guy Black, Thinking Guy Black, and Roland Bynum for sharing their space with us. This will be available at kjlhradio.com. If you want to listen to it, of course, the front page is normally on 4:30 to 6, Monday through Friday, and we have open phones Tuesdays and Fridays. If you want to talk more, please hit me up then. Really, thank you so much, Dr. Noel Reed, Dr. Gloria Morrow, Congresswoman Karen Bass, Dr. Maita Kovengwa, and Herb Wesson, Councilmember Herb Wesson, who was on earlier today. We thank you all so much for sharing your time with us this morning.
Thank you
for having us.
Yes.
Family, thank you for tuning in. And as you go on your way about your day, let's take a moment to affirm ourselves. Let's take that deep breath in and let us release. Today, let me remember, in the words of Fela Kuti, the secret of life is to have no fear. Till next time, Radio Free Family, one love.